tonight the topic is food as medicine, and it's obviously a very hot topic with a large crowd, so thank you all for being here. I want to introduce myself. My name is Deb Davies, and I am the Director of Alumni Services and Community Education here at the college. And my co-facilitator here, Haunani Chong, is a fabulous BCom student, yoga teacher. So I'm sure everybody got a chance to sign in. Thank you for doing so. And just to go over a little bit the structure of the meeting tonight, I'm just briefly going to introduce the group and introduce our speakers, and then each of them will have a few minutes to chat about how they work integratively, what they do, their perspective on food as medicine, and then we're going to open up the floor for discussions after that, after they each have a chance to speak. And the way that we're going to handle questions is with a 3x5 card. So if you didn't get a 3x5 card and would like one, you can raise your hand now. Okay, everyone got one. And there's a box of pens in the back as well. So if you have a question, you can just raise your hand, and Jamie is going to walk around and collect them, and then we'll ask the questions as they come in. If you need to use the restroom or want some food, feel free to leave if you need to take care of yourself. And let's see, basically this meeting started about 3.5 years ago, and it started with a group called Vighne. UCSD runs Holistic Integrative Medical Discussion Group, and it's a bunch of med students and doctors, and they invited me into their group. And I was attending their meeting several times, and one month we had 40 PCOM students show up, and they said, Deb, you need to start a group. So it's been fabulous, and it's so exciting to see the growth here, because when we started with Laura Colton and I, it was 5 to 10 people, and now we have this massive crowd. So thank you for all being part of it. And the purpose of having the Integrative Medical Discussion Group is to integrate Eastern and Western medical professionals and students, and it is open to the public as well, but on how powerful the medicine can be when they're combined. And we're creating just a new growth period in integrative medicine, a higher context for growth, better patient care is our focus. So the word docere is the Latin word from doctor. Doctor comes from docere, and docere means to teach. And it's really important to me because we not only want to teach our patients as healthcare practitioners, but we want to educate and empower people with options in their healthcare and ways to take better care of themselves and to get and stay healthy and have a better quality of life. So we have a couple guidelines. Basically, we want you to speak in a language that everybody can understand. If the acupuncturist says chi or zong fu or something you don't understand, please feel free to ask the question if you need to understand, because chances are somebody else might not understand as well. And the other guideline is please be conscious of the time. We do have a very large crowd, and Haunani is going to be our bell dinger. So if you go over your allotted time, then we will ding you. So please as politely as possible. So I'm just going to do brief little intros on each of our panelists. I'm not going to walk because I'm afraid that I might trip something up with a mic here. So we have Heidi Wittmann is a naturopathic doctor, and Heidi specializes in treating allergies and especially with digestive disorders. We have Sarita Vighne, who is a master's graduate, and she is also an Ayurvedic practitioner from India, so she shares a lot of her knowledge with us. And we have Shier, who's faculty at the college. He actually teaches the Eastern Nutrition class, and he has a new book out that I'm sure he'll share with us. And he's also a doctoral fellow. And then we have Dr. John Kasawa, who's a UCSD graduate, and he practices in the Occupational Medicine Urgent Care Unit at US Health Works in San Diego. And he promotes wellness through lectures throughout the city. So we'll just let Heidi start since she's first, and you get to introduce yourself. So thank you all for being here. You can clip it on or you can hold it, whatever works best for you.
I have a microphone before, this is fun. Hi, I'm Dr. Heidi Wittmann. I'm a naturopathic doctor. And can you hear me okay?
Can you hear me now?
Yeah, there you go.
I'll try that again. I'm Dr. Heidi Wittmann. I'm a naturopathic doctor, and for anyone who doesn't know what that means, naturopathic doctor is similar to a primary care doctor. We learn all of the clinical and diagnostic sciences, but we use natural therapeutics to treat underlying causes of disease. Deb mentioned one of my favorite principles of naturopathic medicine, which is docere, and doctor is teacher. And also another one of my favorite principles of naturopathic medicine is that the body can heal itself when given the right tools. There's a small practice time here in Mission Valley, and like she said, I specialize in treating allergies. I've done a lot of food allergy testing, worked with a lot of digestive disorders, hormone imbalances, things like that. So I want to say thanks for having me here.
My turn. Hello. Can you hear me?
Hi, closer.
Closer? Okay. So my name is Sarita. Like Deb said, I'm a recent graduate from here. I just passed my license exam today. I should be out celebrating. This is it. So I am Ayurvedic practitioner from India. I did it in India 15 years ago. I passed in 91. Long time, and after that I worked in integrative setting with the MD, with my father, my dad, who is MD, for next 6 years, and then I came here, and I've been struggling since. I came here in '97, and I just couldn't work here because they didn't recognize my degree here. So I joined the NAMA conference, which is the national institute here, which recognizes Ayurveda, and so I met few people, and they told me to do something else, like have something, some degree to practice, and because you cannot practice Ayurveda here. So long story short, I'm here, and I graduated. So, but I'm thankful, I feel fortunate that now that I mastered all these two fabulous Asian modalities that I know, and I'm glad to be here today, speaking here. So that's it. Thank you.
Hi, I'm Warren Shier, and I'm a licensed acupuncturist and one of the faculty here at Pacific College. And anybody that knows me knows that I love to eat. A lot. And so I've always had a passion for food. I mean, many years ago, I came to this through an interest in macrobiotics, which evolved into an interest in Chinese medicine, and then which evolved finally into about 5 years ago, deciding to write a cookbook that the general public could use to really eat according to Chinese medical theories. And so this evolved into Ancient Wisdom, Modern Cooking, which came out last week on Lifelong Press. So, so that's sort of, this has been like an evolving, I keep using this word, but it's been an evolving process of this really, what began for me, my interest in Chinese medicine, is a real passion for food and how food is really can be a double-edged sword. It can either be a major cause of illness or a potential cure of illness. And so I guess that's why we're here tonight. Thanks.
Hello everybody, and I'm John Kasawa, and I'm a medical doctor, and we basically give people medications and make them sick. In case you want to know an allopathic, not just joking, totally different. We do a lot of good things. Some things we don't do right, however, but lifestyle medicine, nutrition is the topic, but also sleep.